episode of Alzheimer's Caregiving and the Caregivers, we're back with Dr. Charles Bernick, a neurologist at the Cleveland Clinic Ruvo Center for Brain Health, to discuss emerging treatments that have proven to help those who battle the disease.
I'm actually more focused on conditions such as Alzheimer's disease and things like it that affect a person's cognitive function, particularly as they get older. And Alzheimer's disease, of course, is the most common cause of that, but not the only cause. And so we cover that whole spectrum, both in the clinic and also we're involved in a lot of research, particularly in developing and testing new drugs and new treatments. When we talk about disease-modifying therapies, we're talking about treatments that actually can change the biology of the disease, as opposed to just treating the symptoms of it. An analogy would be, let's say if a person has pneumonia, there are symptomatic treatments, that might treat the cough, but it doesn't treat the pneumonia. And then there are therapies, disease-modifying therapies, that actually change the disease process, like antibiotics. So it's the same thing in the brain. And in Alzheimer's disease, we've had symptomatic therapies for 20, 30 years now, and they help the symptoms of the disease, but they don't change the actual disease. That continues to progress. But now we actually have therapies that can slow the progression of the disease. That is, they truly are disease-modifying therapies, and that's really been the biggest advance in our field, I think, for a long, long time. New therapies that are available are what we would call anti-amyloid therapies, so that they actually are targeting the amyloid in the brain and having your immune system remove it. So we can successfully remove essentially all the amyloid plaques in your brain with these new medications. And again, the earlier you do it, probably the more effect you're going to get from these new medications. People, particularly in our society, always looking for a pill to take or a supplement to take. And the best spent time is on these lifestyle factors, be it diet, exercise, keeping mentally engaged, and maintaining good health in other respects as well. We really invite everyone who's interested to learn more about Alzheimer's disease in general, what's available for caregivers, and also what's new with these new drugs. And you can join us at clevelandclinic.org/Nevada. And that will have the information about some of our programs and what is happening as far as the disease is concerned.